See You Now is a podcast highlighting the innovative and human-centered solutions that nurses are coming up with to solve for today's most challenging healthcare problems. Created in collaboration with Johnson & Johnson and the American Nurses Association and hosted by nurse economist and health tech specialist Shawna Butler.
Welcome to See You Now. I'm Shawna Butler. Maintaining a healthy lifestyle can be challenging, especially when you need to incorporate a new health behavior into your routine. Say you've just been diagnosed with a food allergy or diabetes, and you have to make changes in what and when you eat. Or in another scenario, you may be living with HIV and managing your antiretroviral therapy. These are hard things, and they don't exactly fall into the category of fun. But what if we could turn that around using the charm of gamification?
And I thought, I know how we can use video games for good. I have a perfect example right here. Let's explain how diabetes works through a video game.
On this episode of See You Now, we talk with Anna Sort, a gamer, nurse, and entrepreneur in Barcelona, Spain, and founder of the company Play Benefit, about using fun and games to help people change behavior and promote healthier lifestyles. But as you'll hear, this conversation goes way beyond gaming.
You need to learn anything and everything about getting a business settled and understanding the market and making up prices, value.
Anna offers a toolkit for making ideas become reality. Her insights about the importance of mentorship and managing the financial side of a business are revealing. And her descriptions of using games and simulations to help clinicians develop their skills safely and in a variety of scenarios so that they are prepared for whatever comes their way are so smart. Plus, talking with Anna is just plain joyful. She speaks 4 languages, she's infectiously enthusiastic, and she is the perfect example of what I call an entrepreneur. This is See You Now. Stay with us. So one of the things that I fell in love with when I first met you, heard about you, got introduced to you, was the way you introduce yourself. It's just such a fantastic set of descriptors. So why don't you just have at it? How do you introduce yourself?
All right. So my name is Anna Sort, and I am an entrepreneur, a nurse, and a gamer. And those 3 things actually make a lot of sense when you hear my story all together. Each one of them plays a massive part of how I am and where I am today.
Why don't you open up with the gamer side of Anna Sort?
Wow, this is actually the one that came first, because before being any of the others, I was definitely a gamer. I was 5 years old, and I started playing video games with my brother once we've had an Amstrad in our house. Which was a very, very, very old computer. And that was the beginning of me getting an introduction of video games and the possibilities, the fun. And it was a lot of sharing for me, because I always played video games with my brother up until until he left the house. And then I stopped playing video games for a while. But then he got a job in a very famous company in Spain that was doing football, soccer games, video games. So he actually got me into the video games again, because he was buying me video games, because at that age you do not have the money to spend on video games.
Oh, your brother was supporting your habit, huh?
Yeah, he was. My sister was buying me music. My brother was buying me video games. It was, everything was covered. I was very lucky to have a brother and a sister at that same time. So that's when I continued. And I remember my biggest video game ever was when World of Warcraft came out. And I remember that this was the first time that I played what's called a massive multiplayer online role-playing game, which is a game that you enter and, you can be an elf, an orc, whatever you want. But then all the other elves and orcs and trolls that are around that world, they are other people in their houses. and they are also playing the video game that you're playing. And I thought that was amazing. Like, I was in a world where I could interact with people, that they were like in Sweden, in Norway, and we were all, a bunch of people playing together. I thought that was amazing. And that's probably the first game that really got me very, very hooked. Let's put it this way.
What was it about that got you hooked?
I think it was mostly being able to interact with people. I've been always someone who cares about people deeply, and not like I don't want to solve your problems in your life. Like, I want you to be happy and to be healthy. And that's something that I'm not sure if you're born like this, but I definitely felt like I've always cared about other people. I was really had lots of empathy. If someone was crying, I would go and ask them what's wrong and things like that. So I think nursing for me sort of came naturally from that. On the other hand, being able to play a game, which was something that I really, really, really enjoyed, being able to do it with other people who had their lives and their problems and everything else. And I remember that I would talk to someone in the game and eventually make quite quickly like some sort of relationship with them, and they would start telling me about their life and their issues. And I've always been someone that once people get to know me a little bit, they start talking about maybe things that are more private, or that I usually kept more in private. So I guess that was something that really attracted me from the game, being able to play and also talk and tell stories and share.
So you have discovered the excitement and community feeling and triumph of being a gamer.
Yes. And a funny thing, at the same time, it was when I just started the nursing career that I started playing this game. And on my second year, I actually applied to be in that company, because even though it was customer support, I wanted to go to France to be a nurse. And basically Blizzard is the company that's behind World of Warcraft, by the way. So Blizzard offered a package that they would like get you settled in a place. Like, they would find you an apartment, they would set a bank account, like they would do all these difficult stuff for you if you went and worked with them. So I thought this was a faster path than me trying to apply to get a nursing job over in France. I went on and ended up working for Blizzard Entertainment, one of the biggest video game industries in the whole world.
So you're a nurse at the biggest gaming place in the world, and learning the back end and seeing how the sausage is made, you might say, and recognizing that even games and communities need caring for. Is that
exactly? Yeah, that's an awesome, great way to put it. For a while, I was actually customer support at that company. And then I started wanting to be a nurse again, because I was sort of missing this people-to-people touch that I had when I was a nurse, rather than all being through the internet. And obviously, it's like a different job. You don't take care of people's health. You just take care of their issues. So just at that point, I was lucky enough that the position for nursing they have a position for nursing. If you have a big company in France that's over 600 employees, you need a nurse full time. And so the nurse that they had at Blizzard just had left. So the spot was open and I applied for it. And because I was a nurse, I was already at Blizzard. I spoke the language French, which was for papers and so on. I spoke English, spoke Spanish. So that was all great attributes for me to have. And so I got employed as the nurse for Blizzard Entertainment in the end. So I ended up being Blizzard's nurse.
That's a great, what an interesting way in. So in addition to being the gamer part and having the nursing part, you're also in workplace and doing, I'm imagining, workplace wellness, safety. What are the types of situations or needs did your team members need?
So one of the funny things that happens when you're a nurse in one of those companies is that you know everyone has to go through your hands. Like, it doesn't matter if it's the company's CEO, it doesn't matter if it's like the last person that just got in the company, and you see them all, you meet everyone. And that's also really funny because the vision that they have for the company and what they share with you is totally different. I had from people that would come to me from the lowest in customer support to the highest in the managers, for things like some had allergies, others wanted a double check on something. I would get a lot of people who would not want to go to the doctor yet because they didn't know if that was bad enough to go to the doctor maybe, but they wanted a first opinion for me to tell them, yeah, you should definitely go to the doctor, or no, you're okay. And obviously that ranges from allergies to I have a spot here that I don't know what it is. So it was extremely diverse. And I also took care of all the chronic. So I was aware of every chronic patient that we had, whether it was diabetes or any other type of chronicity. And I would give them checks more often, and I would keep them in track.
You're seeing firsthand the democratizing nature of having a condition. It doesn't matter what position or role you play in a company. Diabetes is diabetes, asthma, allergies, and fear about what is that spot. Everybody needs reassurance. Everybody needs guidance. And so it's a really unique position to be in a company, to see everyone in their full humanity, in their full range of needs. So what was the catalyst for you taking a look at gaming as a method for patient support and education?
So you have to think that most of the Blizzard population when I started working was a young person from under 30 years old, probably the first time that they were away from their country, probably because it was hosting everyone in Europe, just in France. So they would have Norwegian, Spanish, Italians from everywhere of Europe mostly, but some from the US as well. And then the first time that they leave outside their country, the first that they might be living on their own. Most of them came from families, from living with mom, dad, whatever. So we had a problem when it came to lifestyle, because many people would be sitting at work and then they would go home with the bus and then be sitting at home because their hobby was playing video games. Also, we had a problem with food because they would not know how to cook, or they wouldn't bother to cook. They would just order a pizza because that was faster, not fully understanding what that would mean for their body. You have to think that at about 80% of the people that came to Blizzard on the first 2 months, they put on from 2 to 7 kilos.
Oh.
Yes. So the change was massive to anyone who entered. So that's why I started working on having like a health week where I would have like a chef come over and show them how to cook easy, quick meals with just a microwave or just a pan, something super quick and easy, but that was healthy and that was being able to vary it from day to day. Yeah, and I started working on the intranet to give news and publish things depending on the season we were. So people would do things like, I don't know, for the flu season. So what should you be eating, what you should be behaving, and what should you be doing in order to keep up with your health and being able to eat and exercise even though it's cold and everything. So I started doing a lot of this, but then one of the guys that got in when I got in, he was feeling super, super bad. And I went to see him because he was not really able to come see me downstairs. And I said, you need to go to the doctor and you need to go home. So he went to the doctor, and then the doctor just gave him a sleep to go home. Next day I called him and he's not feeling well, and he just doesn't sound well at all. And I have a feeling, like, I asked him what the doctor gave him and whatnot, and I just have a feeling that he might have not explained to the doctor exactly what happened to him, because there was something really wrong with him. So I took him to the hospital. I asked my manager to go get a cab to get him from his home to the hospital because he was refusing to see a doctor again. So, these things sometimes happen. You have to grab someone from the hand and take them. So I took him to the hospital, and unfortunately I had to leave him there because they wouldn't let me go inside the emergency room. But in the end, it turns out that what he had was an undiagnosed diabetes that was giving him a lot of trouble. And then they had to stabilize that first, and then he was able to eventually go home. However, he went home with a diabetes, so a new disease that he needed to treat every day of his life and be very careful with it. So when he was able to come back to work, he came to see me. And what turned out to happen is that he was extremely lost. So I explained everything for him, and he left the time that I was with him super happy, understanding everything. He's like, yeah, and I got this. I know what to do. I'm going to go home and I'm going to do everything right. And I said, okay, perfect. I'll see you in 2 days, see how you're doing. So 2 days after he came, and he was not doing well again. And so that was very frustrating for me. It was definitely frustrating for him because, he had to take all these decisions and I wasn't there with him to take them. So I started thinking, what would happen if we would introduce diabetes the same way we do video games? So like you start slow with the basics, and then you build and you trust. And once you feel like you achieve and you trust and you have all those things, you give a little bit more to learn, and until you master, etc., etc. So I started thinking like how video games are developed and all that stuff, and I came to a video from Jane McGonigal in which she was talking about how video games are going to change the lives of many people and how video games can be used for good. And I thought, I know how we can use video games for good. I have a perfect example right here. Let's explain how diabetes works through a video game. And this is sort of when everything changed for me.
What have you learned about gaming and game theory and gaming mechanics that you're able to apply in helping to educate, manage, support, encourage, have a sense of triumph, have a sense of community? How's that? What are the insights that you've brought to the development of some of the projects that you've got?
So from that point on, there's been a huge evolution. So in the beginning, one of my first projects was actually through World of Warcraft and through diabetes. So I thought, because I was playing the game, I knew there was a thing called add-ons that you could add to modify the way you see your game. So usually game interfaces are very strict. If the map is on the top right, the buttons that you push are in the middle or in the bottom. And your character and the life and mana or energy, whatever that you have, it's on the top left and so on. But you can add things to change it. So if you want the map on the center and have your buttons in the shape of a bird, you can do that through add-ons. So one of the add-ons that I had was to know how far away I was from something. So from my next quest, for example. So I knew that I was 200 meters away. And I thought we can use this 200 meters that my character is going to run and count it as exercise. And so exercise has an impact on the blood sugar levels, so that will make it go down. And one of the things that this game had was that there was a lot of food, from milk, breads, even to fungus. So there was like everything in there. So what we could do is add to an item ID. We could correlate it to affect a sugar in blood bar that we would have. And then people could see, depending on what they eat, if the impact in the blood sugar is very fast or if it's very slow. And we could also give them tips slowly to learn a little bit more on how foods and exercise interact with the blood sugar levels. And lastly, I wanted to add a little button that you could push to simulate as if you would administer insulin in your body. So there you would have the full set. So I actually presented this crazy idea that I had in a Games for Health Congress. And one professor, he offered his students from Rochester Institute of Technology to actually create this add-on and see what happened. So we actually did create an add-on in the end together. where we would have people play a game with their character having diabetes, which was very exciting.
So you have characters in the game that have diabetes?
Yes, if they download this add-on, they would have diabetes, yeah. And so that was one of my first projects. But this is when I learned the hard truth, which is it's great to make something that can help people, but you need some kind of business model behind it. If not, no one would support it. And this was the first time that I learned the hard truth. So this is when Anna starts becoming an entrepreneur and actually trying to create this world that I envision, that I see, that can really improve people's life through video games and education and managing chronic diseases, if you will, through video games. And this is when I created Play Benefit, pursuing how to make these things that people have to do in health fun.
You're listening to See You Now. I'm Shawna Butler, and we're talking with nurse, gamer, and entrepreneur Anna Sort. So we've mentioned diabetes. What are some of the other conditions that are really good candidates for gamification and that Play Benefit is working on?
It was a project, very beautiful project, that was about youngsters that were diagnosed with sexually transmitted disease, because the problem that they have is that they feel shy or they feel shame, especially, and they don't want to tell anyone. And that just keeps on spreading all over the place. So we had developed a whole story around it, that they would be involved in that story. Like the gamification was like a story based. So they were able to warn and sort of stop the transmission.
So you're providing a script to help them with a difficult conversation.
Exactly. We prepare them for the moment that they are going to do that. And we also give them then tools to be able to do that moment, whether it is in person or through SMS, or they want to do it anonymous. But we definitely create the mindset for them to understand that this is important. And secondly, we give them the tools to face this whatever way they prefer.
Why do games work?
That's a great question. And I think the answer is that not all games work. And not all games work for everyone. It's very fascinating when you find a game that many people plays and many people feels comfortable. And when I say many people, I mean ages, sex, everything, like ethnicities. It's very odd because people are motivated by different things. The winning aspect, for example, it's not just about me feeling like I won. It's different. Me feeling like I won because I was better than you is different from me feeling like I won because I was part of a team who won. So it has so many little details that some people are appealed to, some others are more team players. It changes so much that when you create a game, you never know if it's going to be a hit. Now, when I create a game in healthcare, my sole advantage, my target has to do what they have to do in post.
If you're a hemophiliac, if you are an asthmatic, and you have medications that are necessary for you to have some quality of life, those are imposed on you.
Exactly. And those you have to use, and you have to learn how to use them. And it's just a must. You just must do it. So these people, they don't have any other choice. When you play, you have a choice whether you want to play or not. They have to do it. So just by making it a little bit more fun, the satisfaction and that they get is just so massive that it makes a huge impact to their daily life because they have to do it every day. And the same is for a doctor that's learning about a new oncologic treatment, because obviously learning can also be a chore. And there's people who enjoy it, there's people who enjoy it less. So you can always make it more fun. So that's also other projects that we work on, is about how to make this education that everybody has to have a little bit more fun.
In order for you to bring all of these great ideas and games and solutions to the market, you've been on the entrepreneur journey as well. What was the part that was the most difficult?
So this is a very hard question. I would say everything. So when you're a nurse, they don't really teach you, well, now this probably has changed a little bit, but when I studied for nursing, you weren't expected to do anything that wasn't being in a hospital or being in the, first care centers. So you do not have any other sort of training to do pretty much anything else. So a lot of what I had to learn was about like how to manage a business, that you need to put prices on things in order to be able to survive.
You have to talk about money?
Yeah, exactly. And so you need to learn pretty much anything and everything that has to do about getting a business settled and understanding the market and making up prices, value, especially because I was the first nurse to be in gamification when gamification wasn't even talked about. Like, people didn't know what it was. So I had to first educate on what gamification was, and then convince everyone that gamification is what they needed. So besides that, the whole company building and everything. So it was a very exciting journey for me, but also it was very hard because I did not know pretty much anything.
Where did you go to learn? Where were the greatest resources?
Yeah, that's a very good idea as well to talk about that. So the first ones obviously would be like Coursera and stuff like that, like get your education that you missed. Like the last Coursera that I did was about finances.
So you just went online and joined one of the MOOCs.
Exactly. Or a couple. Mm-hmm. Like I joined one of the first one that I did was on creativity, because as I said, it was very chaotic in the beginning. I had all these ideas, but how do you make these ideas actually become something that's true? And how do you make all of this from ideas to prototype? So I also did one of the creativity ones in the very beginning, just to learn about the process and learn more about, because they don't teach you to be creative as a nurse. That's another thing.
You're right. The training is command and control and protocols. Exactly.
And this is actually, now that I teach, because I teach in several universities here in Barcelona, now that I teach, one of the things that I always make my nurse students do is we have some sort of project that they have to do some creativity around or something like that. And it's super funny. There's always one group that brings me a protocol. They just created a protocol. And it's like, okay, this is what we need to avoid.
So embracing your creativity, going online to find your resources. You said you didn't like to talk about money. That's a big part of becoming an entrepreneur. Where did you learn to talk about money, and what did you learn?
So this was probably the slowest one. As a nurse, you just want to help people. You hate talking about numbers, but at the end of the day, anything that doesn't have value is not valued, and things take money to create. So you have two learnings. The first one is learning from, as I said, you can take courses, you can learn from the competition, what are they doing, or you can get ideas from there. But the other one is just experience. And undervaluing a project is something that probably every entrepreneur has done. That's for sure. Fortunately, I had small projects in the beginning and then big projects at the end. So the good part was that I undervalued the small projects. So I was able to sort of come out well with that. And then when the big projects came, I already knew at least, the basics and money-wise understood everything, and find someone that can help you with that. Because I was lucky enough to find that someone in my family, in finance and stuff. And I was super, super glad to have them around, because it would have been so much harder otherwise.
So what are current projects and future projects that you have on the boards?
So we have very exciting things coming up. We're working on collaboration with the EU to get a device for people who want medicines at home. So when they have to take their pills, We have lots of people that have many chronic diseases at the same time. So they probably have to take up to 7 pills per day, every day. That means remembering which pills, how many, in which quantities, what time of the day. It can be really exhausting for people. And there's people who stops taking them, and there's people who messes up and gets an overdose of something. It's really dangerous. So one of these projects that we're working on is developing some sort of, besides the device, that has a little bell and gives a little, the pill that at the time that you have to take it. The other thing that we're doing is gamifying the environment, not only the pill dispenser, but also like what the person does in their day, the family, and like how do we incorporate this all in an environment where if there is an issue, it's very clear, but if there's not an issue, how do we know that this is actually going well? Also, we have another project on learning about a new product from a pharma. What's that called in English? Medicamento. Pill. There you go. Pill.
That was a lot of hard work to get to a simple word.
Yes. Anyway, so we have a pharma company that's developing a new product, and they want the doctors to know when to prescribe it, when to not prescribe it, when it's better, when it's not. So we've created a little game for them.
So optimizing the dosing and the timing?
Yes, and especially not only that, but also like determining if someone should be using this pill or not, or using some other pill, because there are lots of new products in the market, and if you have to, as a healthcare professional, be updated to all of them, it's a big work to do. So making it a little bit more fun, making it a little bit more entertaining, more like I'm gonna play this game rather than I'm gonna read these 2 papers about this thing. And we work a lot with simulations and making it like it's a real thing. So, being able to experiment in a game rather than experimenting in real life with people, that has a lot of good feedback from the healthcare professionals in general.
So that the first time you do it isn't actually the first time you do it.
Exactly, yeah. I don't know how it was for you, Shawna, but I remember when I was learning how to do a injection, which is one of the things that nurses do most. I remember using a little cushion to do that. Or the pillow, sorry, not cushion.
Yeah, we used a lot of oranges. And
oranges?
Yeah, a lot of devices that would mimic anatomic accuracy.
Yeah.
You're right. It's interesting going from the practice where it is a pillow, it's not a person, it is something that is inanimate, doesn't have feelings. And then you go into that environment where this is the real thing. And this is a person, and I'm a human being. This is intimidating, and the stakes are high. You want to get it right. And even when the stakes aren't all that high, you still want to get it right. And even if your technique is correct, that doesn't mean you necessarily come into it with confidence. And that confidence that you have definitely impacts the person that you're caring for. Can you give them a sense of comfort and calm in addition to technical accuracy? So that role of simulating, game playing is so important in all aspects of the care delivery.
Yes. So one of the things that now we're seeing more and more is also these elaborate simulations in 3D in which, because even if you have a mannequin, it's not going to react to what you're doing. So what we're doing is also doing a lot of these simulations that are more of animate. So when you do something, you get a real sense of reaction. So it's not just about doing it right, as you said, the technique right, but also being able to stay calm, do your job well in a very stressful situation.
The gaming community has been the leader on all of that to give us opportunities to figure out what are the responses with these different scenarios.
Yeah, and funny enough, when I was in the last Games for Health session in Amsterdam last year.
Yeah, what is Games for Health?
Games for Health is a congress held in Europe that's about like new game technology used in healthcare for many different reasons and many different aspects, from researchers to rehabilitation, for example. So in one of the last Games for Health that I went congresses, there was this game that you would have one of those bands that control your heart rate. So you would have to slow down your heart rate in order to get into some places, and then you would have to higher your heart rate to get into other places. So you would need to be able to control these in order to play the game. So I thought that was very exciting.
That is helping people to breathe more calmly or to relax, using a gamification to get somebody into the proper emotional state, and using respirations and heart rate in order to help people monitor and measure to get to the state of calm that you're needing or is more beneficial.
Yes, exactly. And being able to get excited or calm down in different situations while you're playing a game. There's definitely a learning curve there.
What other areas do you think that gamification is promising and we should be pursuing?
I think gamification can pretty much improve anything, as in, imagine people being super healthy because they are super motivated to be super healthy. Well, that would be very good news, especially within the epidemic that we have on obesity and all other things that we have.
Yeah, there are a lot of them out there. Vaping is just on the rise. We've always had smoking cessation has been a goal and a target. Tobacco control, getting people when they're ready to quit, helping people to not start. There's so many behaviors that need some attention, that need some fun and games.
Yeah. So I think education, lifestyle, all those things can really benefit from being gamified because they're most of the time things that you have to do. So keeping healthy is one thing that you have to do.
The other thing that I'm thinking about is when we talk about gamification or games, we often imagine a person or a child sitting isolated alone in front of a screen. How is it the games are helping to build community health and population health?
I think you hit a very important point. Many of the gamifications that we do, they have some sort of social component and some sort of real life component. So it's not all virtual. And I think we need to be moving more into that direction rather than keeping everything digital, because we are seeing this generation that might have more problem interacting with people face to face, that they have lots of friends online, they have all the part of these communities online, which are important, and we must not deny the importance that they have. But how do we balance them with real life? So let's take all those good things that the virtual world has and put them in real life, so people will want to live their life rather than live in the video game. And if you can have like a balance of those two things, I think this is when we will actually have a win-win and the society can advance.
Anna, this has been so fun. Anything you want to add that I have not touched on?
I think I would say something else, yes. I think one thing that motivates us, and I would say nurses especially, but I would say everyone, is when we're frustrated. Sometimes we get to a point when we are frustrated. For example, when I had my diabetic patient and I saw that we couldn't get forward, that was a hitting point for me. It was frustrating. And I think we can build from those frustrations. We can definitely do something with those frustrations. So if you're a nurse anywhere and you find that place where you hit a wall, you're frustrated with something, do not just try to adjust to what's going on. Try to think in a creative way of what would you do instead? What would you rather have? What would you see? What would you envision for this process to be or this thing to be? And then go ahead and do it, because I think nurses have highly creative power. So use it, because there are not many nurses that are willing to do that. And if you're one of them, then use it and make sure that you're heard. That's what I would say.
Well, I think you've got probably a lot of people who want to come and join your team and convert to the gaming side of the world. So
please.
Anna Swart is a gamer, nurse, and digital health entrepreneur. She has a master's degree in cognitive systems and interactive media. and she is the co-founder of 2 digital healthcare companies, PlayBenefit and Alvum. One thing that I thought a lot about after this conversation are the number of programs popping up around the globe that support nurse-driven innovation. There's a growing movement to include innovation and entrepreneurship into nursing curriculum and practice. Anna herself teaches as part of the Stanford University Ventures and Harvard's Serious Games for Health through the University of Barcelona. And in the U.S., at the University of Pennsylvania School of Nursing, for example, they've built Design Thinking for Health. It's an online platform and a course that teaches a framework to tackle the complex challenges in healthcare. It's open to anyone. Check it out. And at Northeastern University, led by their School of Nursing, innovation and entrepreneurship have been included in their undergraduate curriculum. And the Innovation Studio at Ohio State University School of Nursing, they exist to foster interprofessional collaboration in creating healthcare solutions. These are just some of the ways that nursing is leading in transforming healthcare to meet global health challenges. Oh, and this conversation also reminded me of one more thing. As Ralph Waldo Emerson said, nothing great is ever achieved without enthusiasm. This is See You Now. I'm Shawna Butler. Thanks for listening.
See You Now is created in collaboration with Johnson & Johnson and the American Nurses Association. Johnson & Johnson is proud to power up nurse-led innovation that is transforming health outcomes through skill building, leadership development, and more. The American Nurses Association ignites and celebrates nurse-led innovation to redefine quality nursing and advance healthcare for all. To learn more about these programs and See You Now, visit seeyounowpodcast.com.